for moving patients. So today, it's all in bed. We're going to move patients in bed. So today we're in bed. Next, in 2 weeks, we'll be getting them out of bed to somewhere else. So we're in bed. So before you see a patient, before you even go wash your hands, because I know you can do that before you see the patient, you need to read the chart. So always, always, always read that chart. Okay? Always, always, always read the chart before you see the patient. Let's say you saw the patient let's say you saw the patient in the morning, and then you also see the patient in the afternoon. You must read the chart, because patients change from moment to moment. So, very important that you read the chart before seeing the patient. Always, always, always do that. Also very helpful, especially if you work in an ICU, is to talk to the nurse before you see the patient. Because people aren't always timely in their documentation. And the nurse will tell you, oh yes, the family is such a pain, they're really worried about this. And it may not be in the note, but they'll tell you. Or, oh yeah, we just started with this new device. That's what it is, and you don't have to worry about it, it's okay. So nurses are very helpful, they're your friends. So talk to the nurse. So before you see a patient, talk to the nurse, read the chart. Always, always, always read the chart. Great quiz question. You're treating a patient Friday afternoon at 4 o'clock, and it's a half an hour till you get to go home and do happy hour. And it's been a long week, and you have one more patient to go, and you can't find the chart. Should you treat the patient? No. Do not treat the patient. Do not evaluate the patient until you've read the chart. Okay? So that's a huge biggie. So everybody got the answer to that? Always read the chart before you see that patient. Okay, the chart's also going to tell you about any restrictions that patient has, which is really important. Sometimes there'll be things that you're expected to know, like if the patient's a total hip replacement, what are going to be the contraindications for seeing that patient, for doing with that patient. So no hip flexion greater than 90 degrees, no adduction past neutral, and no internal rotation past neutral. Okay, so all of those things, and no crossing the legs. So you know all of those things, and you got it just from reading the chart. The patient's not going to be able to tell you that, because a lot of times they're way out of it. So you're the one that's responsible for knowing. So, let's say the patient was on some type of isolation. Let's say they had something like some kind of respiratory droplet. Ebola, okay. Then you'd be getting everything out. They'd be in a separate room. But let's say, this is just your general run-of-the-mill patient that has TB. And so it's droplet precautions. And so you definitely want to wear a mask, and you probably want to wear a gown because the patient's coughing, and you definitely want to wear gloves. And you don't know that when you go to the room. You can see there's a bunch of stuff outside the room. If the door's open, that's a really bad sign, okay? Because the door's supposed to be closed if they're on isolation. Okay, so always make sure what's going on with the patient, and it will be in the chart. So another reason for reading the chart. One thing that is real important when I go to see a patient, especially in acute care, they usually have some kind of tubes and lines. They've got an IV, they've got a urinary catheter, they've got they may have a monitor for their heart. They may have all sorts of things. Okay, it's important before I go move somebody to see what's there. So is there an IV there? What other lines are there? Is there a drainage tube? Because I don't want to pull any of those things by moving the patient. So I want to make sure that they're out of the way if I go to move the patient. So I count before I move the patient. I also count afterwards in case I accidentally dislodge something and there's now blood all over the bed or whatever. So I usually count, make sure to move everything out of the way, and then after I've moved the patient, I count how many lines there are as well. We'll get a chance to practice a little bit in the nursing lab at the very end of the semester. I'll be thinking about the Italian billet by then. I know, it just seems weird. Anyways, you'll get a chance to practice this in the nursing simulation lab. We'll have some pretend lines, like we'll have a urinary catheter, but we'll tape it to your leg. We aren't going to actually stick it in there. We're not doing IVs. I don't do needles. Deepa's certified in dry needling. I'm impressed. So I think that's great. But I am not. So, no, we are not doing that. But they will be attached so then you can kind of feel like, okay, I need to watch out for this. Make sure that it's out of the way. So we'll get to do that much later on. Okay, so so what are you going to do before you see the patient? Talk to the nurse. Wash your hands. Okay, so probably in all that order. Okay. Yeah, if you need it, definitely. Yeah. Another thing is that sometimes it's helpful to talk to the nurse about what you can remove or disengage before you move somebody. Because a lot of times you can take a monitor off or whatever so that you don't have to worry about one less line or one less drainage. Usually drainage tubes you're not pulling out. Anyways, so moving on, just like we did in body mechanics, you're going to want to plan what you're going to do. So you want to make sure that you have a clear pathway, that you're not going to be tripping over shoes, you're not going to be tripping over backpacks. So you want to make sure that there's a clear path. Also, something that's real important if you're doing a two-man kind of transfer is that you communicate what you're going to do not only to the patient, which is really helpful, but also to the person that's moving. So everybody knows who's going to do the counting. And are you going to move on 3 or are you going to move on 5? There's no 2.5. Are we going to move to you or away from you? So all of those things said before you actually move. Another thing that's really helpful is that you test the load. Remember we learned that in body mechanics, test the load? You want to see, is this something I can do? And if you test the load and you go, no way I can do that. No way the two of us can do that. We need more help. It's time to get help. And it's a lot easier to do that before you get the patient up than partway through.